If you're retiring before age 65 and you need to figure out health insurance, you do have options. There are more than a couple. I'm going to go over the options for people just retiring before 65, early retirees. If you're leaving the workforce, if you're shifting to part-time work, you're losing benefit eligibility, or you're transferring to self-employment, doing contracting, that kind of thing. Also goes for spouses of people who are going on to Medicare who aren't Medicare age yet, so 65. This is super important for obvious reasons. It's probably the biggest expense, one of your biggest expenses if you're retiring early. So you got to make sure you're paying for what you need, not more, not less. There are some traps out there that will leave you overexposed. So let's try to avoid that. So let's go into the options. The first is the most obvious one, and that is COBRA. So what this is a temporary extension of your employer coverage. So from your job or your spouse's job, once employment ends, you have usually up to 18 months to continue that plan uninterrupted. The good thing about this, you get the same benefits, you keep the same benefits. The plan is the exact same plan. There's no interruption to your doctors, the network. If you have ongoing treatment, expensive prescriptions, you like how the coverage works, and that's priority to you, then COBRA is a good way to go, probably the way to go. The con here is the expense. So the pricing for COBRA is whatever the price, the top line retail price, let's call it, for that employer coverage, and you lose whatever the employer was contributing to that cost, which is usually at least 50%. Ballpark, when I see people's COBRA options, $800 to $1,200 a month for an individual. For couples, it's usually double that, just rough math there. So this is best for people who are high earners who aren't going to get subsidies on an ACA marketplace plan, which we'll talk about next, or if continuity of coverage is really important to you and crucial. If you've got treatment for something going on, that's going to be your best option. Option 2 is an ACA marketplace plan. So these are commonly referred to as Obamacare plans. I don't like that term because it's old now and it doesn't really make much sense. But ACA marketplace plan is the correct term. So these are plans sold through healthcare.gov at the federal level, or if your state has their own version of healthcare.gov, there'll be a certain name for it. Like in Georgia, where I am, it's called Georgia Access. Basically, that's just like in Amazon.com, where these individual ACA compliant plans are sold. The good things about these plans, they are guaranteed issue, which means they can't ask health questions to deny you coverage or accept you, make that determination. No exclusions for pre-existing conditions. There are no benefit caps. So like they won't stop paying at $1 million or something like that. That doesn't apply here. And the biggest thing is you might qualify for subsidies in the form of tax credits if your income is within a certain range. Usually for someone in their early 60s, I see that as this is highly dependent on your zip code, but below 60,000 for a single person, below 100,000 or so for a couple, you're going to get some decent subsidies that bring the cost into something like a reasonable range. So for that reason, if you are retiring early, your income's probably going down. It might not be, but if you can plan your income sources as far as what's going to be taxable, because that's what the subsidies run off of, if you can lower those to where it will bring your subsidy higher, then that can be a big win for these plans. The big con about these plans is the networks. So they are small, they are local, and in many cases, they are HMOs or EPOs, not national PPOs. So it's really crucial to make sure that all your doctors, all your facilities, hospitals, as many as you can, are in the network of the specific plan you choose. There are a ton of different insurance companies sell on this exchange and these state-based exchanges. So you really got to dial that in. This is the best option for people with moderate or average income, where those subsidies really make a meaningful difference in price. And if you want those strong consumer protections, like no pre-existing condition limitations, you've got a lot of strong consumer protections with these plans. So that's a good option. And it's because it's a guaranteed issue type of plan, then you can always count on it. If you lose coverage in the middle of the year, you'll be able to jump into one of those plans. The next option is underwritten PPO plans. So these are private, off-market, off-exchange plans for people who, this is a best fit for people who make too much money to get a subsidy on an ACA plan. And because those ACA plans are so expensive for them without a subsidy, they are usually craving an option that is better value and perhaps has a bigger network, like a PPO network. These plans are from smaller insurance companies, probably ones you haven't heard of, but the ones that are done well are excellent options. They're usually medically underwritten, so you're going to have to answer health questions to the satisfaction of that plan for them to offer you coverage. That's the key. Some of them will exclude pre-existing condition treatments. Some of them don't. The network is the big deal here. Like you want to find a national PPO network. That's the whole point of searching for a plan like this. And they are out there, but this is for healthy people who make usually on the higher end of income, where COBRA is just extraordinarily expensive. This is a nice middle ground between an ACA plan and COBRA. Another key point on these, you usually need to still be working, usually doing consulting work on a 1099 basis, not as a W-2 employee somewhere. But these plans like to have people who are still in the workforce earning a living as members on these plans. The next option is short-term medical, short-term health insurance. So as I'm recording this in 2025, the maximum term you can get on these plans is 4 months. Technically, it's 3 with a 1-month extension is the maximum. In the past, you've been able to buy these plans for up to 3 years at a time. That may come back. I hope it does come back for the sake of there being another good option out there. But as of now, it's a quarter at a time, generally speaking. These are also medically underwritten. Approval is usually pretty quick. Coverage can start the next day or within a couple of days. There are going to be limits to the benefits. So like they'll have a $500,000 benefit maximum for the term, or some as high as $1 million or $2 million. But there is a limit. So if you've got a diagnosis of a dread disease or something else very expensive, you may run into the plan maxing out as far as benefits go. PPO networks are the norm with these plans. So you've got a national PPO. That's a big draw to these. The con to this is the benefit maximum, like $1 million or $2 million, sometimes as low as $500,000. The rules, the regulatory environment around these changes a lot. So it's not guaranteed that you'd be able to buy it for a year at a time or a couple years at a time all the time. But a good option, and it's usually a less expensive option than the others that we've covered so far. The last option is not health insurance, but it is similar. You've probably heard about it, and it's health sharing ministries or health sharing communities like MediShare. The one I like is Sedera. It's not faith-based or faith-affiliated, which a lot of people prefer to stay away from. Basically, the way this works is the members of this community come together and they pay into it monthly, a regular amount, to establish a pool of money to help pay for each other's medical costs. That's the general idea, but it's professionally administered and there are rules around it. It looks a lot like insurance, but it is not legally insurance. It is not regulated as such. So just be aware of that. There's technically no guarantee of payment, but the ones with good reputations do have a good track record of payment, but it is a risk. If you're okay with that, and in exchange, you get to pay a lot less for some sort of coverage for your medical expenses, it's a good option. The way this works is you would pay for the service of whatever it is, the office visit, the procedure, the scan, the lab test, and you'd submit it to the community, to the plan, and they would decide whether to reimburse you or not. So if you're comfortable with that and you want low monthly costs for coverage itself, then it's a good option. And also, if you're a little bit of a rebel and you're sick of the system and fed up with health insurance and how it works in this country, which I don't blame you for, this is a way to stick it to the man, I would say, and still get some sort of coverage. So those are the 5 main options. A couple other things like bonus options that might apply to you. Some might be obvious, some might not be. Your spouse's employer plan. If your spouse is still working, you can either join that if you haven't already, or you can keep it if you retire and they still keep their job. That's pretty obvious. You can get a part-time job with benefits. Some employers do offer health insurance for part-time employees, so that can be an option. Group association plans. So if you're self-employed or you're a small business owner, if there's a professional group, like if you're an accountant, an association of accountants, chambers of commerce might have options or access to a plan specific for them or to people like them. So those are some other options to consider. So really, there's a whole gamut of budgetary options of depending on your risk appetite, depending on your health status, your income level. That all goes into what is the right option for you until you hit Medicare at age 65. So hope that was helpful. If you'd like my help figuring out what is right for you, you can schedule an appointment with me. Link is in the description, and I'll see you in the next one.